Now, in the middle of this surge, it's tough to see the positives here. But in the last 19 months, researchers have made huge leaps in preventing and treating the illness. One of the highly effective treatments healthcare workers can rely on is monoclonal antibodies. It's not a cure, but it can help keep those with COVID from being hospitalized. And as News Center Maine's Don Kerrigan reports, that's the kind of relief hospitals really need right now.
Since September, hundreds of Mid-Coast residents with COVID have been finding some relief at the urgent care in Booth Bay Harbor.
The infusion takes about 31 minutes to infuse.
Brenda Thompson is the nurse manager of the Lincoln Health Emergency Room and oversees this antibody program. Monoclonal antibodies were given emergency approval by the FDA about a year ago. Thompson says the antibodies attach to the COVID virus inside the patient and slow or stop it from spreading. It's a treatment, not a prevention, and not a cure. Thompson says most of the people they treat are unvaccinated and at high risk of becoming seriously ill.
Patients will have about a 70% decrease in their symptoms within 24 to 48 hours.
Really?
Yeah.
So this is a pretty good treatment.
This is a pretty good treatment for patients, especially our high risk, mild to moderate symptoms.
The CDC says demand for monoclonal antibody treatments has gone up as the virus has swept through Maine and more sick people have had to be hospitalized. The Maine Hospital Association says most hospitals around the state are now offering the treatments, but the drugs for it are on allocation from the federal government. The Maine CDC says it gets enough for 500 to 700 doses per week. About 8,000 have been used since September. Brenda Thompson says the treatments are making a real difference. Some patients have still needed further medical help, but the majority, she says, have not.
For the most part, for what we're seeing, patients are not needing hospitalization after, and they're actually calling us and telling us they're feeling better, in a couple days. So it's been rewarding. It's hard work. This team is working hard.
Lincoln Health says the number of patients they can treat here each week is limited by the number of staff people available and the amount of drugs they're allocated by the Maine CDC. If they could get more of both, they say the need and demand for this treatment is clearly there. In Booth Bay Harbor, Don Kerrigan, News Center, Maine.
Maine CDC Director Dr. Nirav Shah says those antibody treatments are effective, but should not be considered an alternative to getting vaccinated.